I'm Andrea Cooley, one of the owners of Des Moines Mom, and today we are talking to Dr. Amy Ferguson, who is a pediatric doctor at Blank Children's Hospital. And we're going to be talking about RSV and flu and the different symptoms that parents can look for and when they should seek out help from their provider. So, what can you tell us about RSV versus flu?
It's a great question. So they can present pretty similarly, depending on the age of the kiddo. In younger kids, they can have lots of congestion that we have to suction out a ton. If we're not doing a great job at that, they can not eat as well, which can lead to dehydration. Usually with influenza or flu, we'll see kiddos can have higher temperatures. So that's something that's a little bit different than with just RSV or other viral causes of bronchiolitis. We also can see in older kids, they can get a little bit of like muscle pain as well with influenza as well too. So if you're noticing your kiddo having those higher fevers, it may be that they have flu instead of one of the other viruses.
Okay, so if you're noticing that or suspect that your kid might have RSV or flu, and you bring them in, what kind of help or whether either in the ER or in the doctor's office can we hope to find?
Yep. So usually if you bring them to the ER or to the clinic, they may go and kind of do some really good suctioning on your child. They may test your baby to see if they have RSV or flu. And so that may be something we do a limited viral testing that can tell us if they're positive for that. And usually we'll test with COVID as well too. Still, so they'll be able to tell you if they are flu positive or not. Sometimes they will treat if your child is more high risk with Tamiflu, but sometimes they won't. So Tamiflu is a medication for influenza. And so the outpatient pediatric or family practice providers are really great with knowing when that's indicated and not. And so they will talk to you about that medication as well too. With RSV, there is not any medication that we can give to make them better, but sometimes you'll find just like when we're sick, we feel just achy and cruddy. So sometimes, depending on the age of your child, they may instruct you to give Tylenol or ibuprofen, depending on the age. You want to make sure that to use Tylenol, they're at least 2 months of age or older. Ibuprofen is at least 6 months of age or older. So that just kind of helps with the body aches. So your child may not be having fevers with their virus, but I feel like sometimes they're just really fussy. So your provider may do that. They will also check to see if your child is dehydrated. Like we talked about a little bit earlier, sometimes it's really hard for especially younger kids to go and breathe and eat at the same time. So if they're really clogged up in their nose, they may not want to eat as well. And that can lead to dehydration. So if they're worried about that and not having a good number of wet diapers, or there's other exam findings that we can look at for dehydration, they may want your kid, if you're in the clinic, to go to the ER and get some IV fluids. Or if you're in the ER, your child actually might get admitted just because they're not eating super great. They may not require any oxygen support, but they're just going to need IV fluids. So we see that as well too.
Okay. That's so helpful. I know as a parent, especially with little kids, you can feel so helpless. Like you can't blow their nose for them. You can't help them. So what are any other symptoms that parents should definitely pay attention to and, possibly get some help if they see them?
Yep. So the congestion is always the thing that people hear, or the cough. So having a good nose sucker outer will be great. So if you have just the bulb syringe that they usually give you from the newborn nursery, it might be time to buy something else. There's a lot of devices that you use your mouth as the suction, which some people find very gross, but I think they work really well. Or there's battery operated ones. The big thing is you need something else other than the bulb syringe most of the time. Other things that you can watch for, so they can, if that snot and mucus is getting down into their lower airways, they can have what we call increased work of breathing or retractions. So they can go and you might notice that your baby or your child is just breathing really fast, or they can actually pull in and suck really deep under their lungs, or
Mm.
they can pull above their clavicles or collarbones, or sometimes their nose is just really kind of going and flaring. So those are signs that they're using other muscles outside of their lungs to breathe. And so if your doctor or the ER doc see that, they may go and actually start your baby on oxygen just to help your baby aerate all the different areas of their lungs, to help decrease how fast they're breathing.
Sure. Those are great symptoms to look for and just things to be aware of. And as we head into the fall and winter, we start thinking about vaccines.
Yep.
I think flu vaccine is top of mind, but are there other vaccines or, precautionary things that parents should look into for their kids?
Yep. So flu vaccine has been around for many years, and so we recommend getting that. So if your child is 6 months of age or older, they can get their first flu shots. Usually they will go and recommend they come back within the first month, because it's a 2-shot series when it's their first year. One thing that I think is exciting, but we don't have a lot of instruction for yet, is that there has been FDA approval for a RSV shot for older people and pregnant women. But then there's also an RSV like monoclonal antibody, meaning it's not an immunization, but it gives you a antibody as something that will help prevent them from getting sick, basically, for pediatric patients. So that is something that the FDA recommends for kiddos going into their first respiratory season, as long as they're, I want to say they have to be older than 6 months, but so that'll be something to ask their provider about this fall, because here in the hospital, we haven't heard whether that will be a hospital given thing or a clinic based thing. So that's a really good thing to give. And then they are still recommending COVID immunizations for kiddos. You can get that again at 6 months of age or older. So if you have any questions about that, I would make sure to ask the provider that's seeing your child.
Okay. That is all really great information. Thank you so much,
Yeah.
Dr. Ferguson. Hopefully we can work together to have healthy kids this fall.
Let's hope so. Yes.
All
Thank you
right.
for having
Thank
me.
you.